Okay, so you know that awful feeling, right? When your stomach just flips and you know you're in for a rough couple of days? Yeah, the stomach bug.
Ugh, don't remind me.
Well, it seems like norovirus, the, infamous winter vomiting bug, is
Yeah.
making an unwelcome appearance this summer.
Really?
Yeah, especially in the UK. They're actually seeing a surge in cases, something like 3 times higher than what's normal for this time of year.
Wow, that's unusual.
It is. So we've been looking at some articles, research, all that on this outbreak, and thought we'd do a deep dive into why this is happening now, what it could mean for everyone.
Yeah, it's really strange to see this kind of spike outside of the typical winter season.
Right.
Well, it's fascinating, actually. The UK has reported 154 norovirus outbreaks in just the last few
Oh,
weeks,
wow.
compared to like an average of 53 for the same time period over the past 5 years. So, big
It was
difference.
a huge jump. What's going on?
Well, it's not just the UK, actually. While we're focusing on them right now with this current surge, norovirus is, it's a global concern.
Oh, right, of course.
The CDC in the US, they've actually issued warnings about it, emphasizing how easily this virus can spread. Anyone can get it.
Okay, so we know it's contagious, but how does it actually spread? I mean, we've all gotten really good at hand washing the past few years, right? Is that enough to stop this?
Hand washing, oh yeah, it's crucial. Absolutely.
Okay, good.
But what makes norovirus tricky is that, unlike some other viruses we've been dealing with, it doesn't have that lipid envelope.
Well, what?
Lipid envelope. It's that outer layer that alcohol-based sanitizers can usually disrupt.
Ah,
So those sanitizers, they're great for a lot of germs, but not as effective against norovirus. Good old soap and water are still your best bet.
ah. So back to basics.
Exactly.
So to understand why it's so good at making us, well, sick,
Oh, yeah.
we need to actually look at the virus itself.
Yeah, so it's a very small RNA virus, and it mainly spreads through close contact with an infected person.
Okay, so like being near them.
Right, exactly. But it can also be transmitted through contaminated food or water,
Oh, yikes.
or even by, touching a surface that's been contaminated and then, touching your mouth.
And that's what leads to, well, you know,
Yeah, so norovirus causes gastroenteritis.
which is,
It's basically inflammation of the stomach and intestines.
oof.
Yeah, and that leads to all those classic symptoms, to diarrhea, vomiting, nausea, stomach pain, sometimes fever, headaches, body aches, but those are less common.
And the worst part is you can get it multiple times,
Yeah.
like throughout your life.
Yeah, that's right. You see, there are actually different types of norovirus,
Oh.
and immunity to one type doesn't protect you against the others.
So even if you had it before, no guarantee you won't get it again.
Exactly. And what's really interesting about this outbreak in the UK is where it's happening. A lot of the cases are concentrated in educational settings, especially nurseries.
Nurseries, like daycare.
Yeah. It's really unusual for the summer months. We usually see outbreaks in those places during the winter.
So why nurseries? Are kids just more susceptible?
Well, Professor Sahir Garbia, he's the deputy director of the National Infection Service in the UK, suggests it might be because young children haven't fully developed their immune systems yet.
That makes sense. And they're, always around each other, touching everything.
Exactly. You've got kids in close proximity, sharing toys, touching surfaces. It's not always easy to make sure they're, washing their hands properly.
It's like the perfect storm for norovirus.
Yeah, pretty much. So for parents and caregivers out there, be extra careful with hand washing and hygiene, especially if your kids are in nursery school.
Good advice. So this summer surge, it's definitely out of the ordinary. Researchers, health officials, they're all paying attention. What are some of the things they're finding? What's coming out of all the research we've been looking at?
Well, one thing that really stands out is this idea of a rebound effect. We touched on it a little earlier.
Right.
Professor Garbia, remember him?
Yeah.
From the UK?
Yeah.
Well, he's pointed out that, during the pandemic, with all those restrictions, lockdowns, and all that, norovirus cases actually dropped a lot. And now that things are back to normal, people are interacting more, well, we're seeing this resurgent, like the virus was just waiting for its chance.
Like it was hiding out.
Yeah, exactly. And like we've been talking about, we're seeing this a lot in nurseries.
Right. That's been a big focus.
And one of the articles we have actually goes deeper into how tough it is to control these outbreaks in nurseries.
Yeah, kids. Right.
It's tough. They're more susceptible, like we talked about, and they're not as good at, all the hygiene stuff.
Washing hands, not touching their faces, all that.
Exactly. And nurseries, well, kids are always close to each other. It's unavoidable. It's like the perfect environment for this kind of virus.
Yeah, it makes sense.
The research really stresses how important it is to have strict hygiene rules in nurseries. But even then, even with the best efforts, it's still really hard to contain these outbreaks.
So it's not just about like individual parents doing their best. It's also about making sure the whole environment is as clean as possible.
Absolutely. And it makes you wonder, are there any lessons we can take from, COVID? Things that might apply here.
That's interesting. We spent a couple of years, changing our habits, all that hand washing, social distancing. Could some of that help with norovirus too?
It's possible. Like, we're all way more aware of hand hygiene now and disinfecting surfaces. Those habits, those could definitely help reduce the spread of norovirus.
Like we've raised the bar for cleanliness in general.
Right. And remember all that talk about ventilation systems, air filters, all that stuff with COVID.
Oh, yeah.
Well, while norovirus isn't mainly airborne, some studies say better ventilation could still help, especially in places like nurseries where there are a lot of people.
So maybe in trying to fight COVID, we accidentally made ourselves stronger against other things too.
It's possible. Of course, we need more research to really know for sure how much of an impact all these changes have had.
Makes sense. One thing I was thinking about as I was reading all this, there's no vaccine for norovirus, right? I mean, we have vaccines for so many other things.
Right, good point.
So why not this?
Well, it's actually pretty tough to develop a vaccine for this one. One of the biggest hurdles is, well, there are just so many different strains of
Like
norovirus.
we talked about before, yeah.
And if you're immune to one, it doesn't mean you're immune to the others. So making a vaccine that works against all of them, it's a big challenge.
Okay, so it's not like the flu shot where they just target a few specific strains.
Exactly. And on top of that, norovirus is, it's quick. The incubation period is really short. You
Mhm.
get sick really fast after you're exposed. So there's not a lot of time for a vaccine to do its thing.
Like it's always one step ahead.
You could say that. But don't worry, it's not all bad news. Researchers are working hard on a vaccine. There are actually a few different vaccines being tested right now, and hopefully we might have something soon.
Fingers crossed, that would be huge, especially for, young kids and older folks. They're the ones who get hit the hardest.
Definitely. A vaccine could prevent so many outbreaks, and it would take a lot of pressure off healthcare systems.
So there's hope.
There is.
Okay, so we've talked about all this, the rebound effect, nurseries, vaccines, but there's another piece to all this, something we haven't really touched on yet, climate change.
Ah, yes, that's a big one. More and more research is showing that climate change could be messing with how norovirus outbreaks happen.
Really? In what way?
Well, think about it. Warmer temperatures, changes in rainfall, all that, those could create the perfect conditions for the virus to spread more easily.
So it's not just us, our behavior, hygiene, all that.
Right. It might be bigger than that.
Wow. So we've got all these different factors at play. What we do, the environment, and the virus itself constantly changing.
It's complicated. It's a lot to consider. And it means we need to think about public health in a whole new way.
Before we go too far down that road, though, I think we need to remind everyone about, what to do if they start feeling really sick.
Absolutely. Most of the time, norovirus runs its course in a few days, no problem. But there are times when you really need to see a doctor.
Right, so if you've got diarrhea that just won't stop or you can't keep anything down, or there's blood, or you have bad stomach pain, or you're getting dehydrated,
Yeah, any of that, go see a doctor. Or go to the emergency room. Don't wait.
better safe than sorry.
Exactly.
Okay, so as we wrap up this part of our deep dive, it's kind of crazy to think about.
hmm
We've got all this medicine technology, all this progress, but we're still vulnerable to these tiny little viruses. They can really turn things upside down.
It's true. It reminds you that we're all connected, part of this big ecosystem. Our health, it depends on the health of the environment, on everything around us.
It's like we're in this constant battle with viruses,
Mm.
trying to stay ahead, but they're always there, changing, evolving, always finding new ways to challenge us.
That's a good way to put it. It shows just how important research is and how important it is to be aware, to pay attention to what's happening, and to learn from every outbreak, even the ones that catch us by surprise.
Well said. Okay, let's move on to the last part of our deep dive. Let's look at what all this could mean for the future. All right, so we've talked a lot about this summer surge, the science, the challenges, all that. But the big question is, what happens now? Is this just, a one-time thing? or is it a sign of bigger changes?
That's what we're all trying to figure out. It definitely throws a wrench in our, thinking about norovirus. We've always thought of it as a winter problem.
Right.
But now, seeing it spike in summer, it makes you wonder, could it be, changing, becoming more of a year-round thing?
So not just seasonal anymore?
Maybe not. We have to think about all the things we've discussed, right? How people are behaving, the end of those pandemic restrictions, even climate change. All of those could be playing a role in how norovirus behaves.
Like the virus is adapting, finding new ways to succeed.
Exactly. And that means we need to change our approach, too. We can't just focus on prevention during winter. We need to be ready all the time.
So a more proactive strategy,
Yeah.
year-round. What would that look like? Give me some specifics.
Well, first, we need better tracking, better surveillance systems. We need to be collecting data, analyzing it, really understanding what's driving these outbreaks.
To be able to respond quickly, no matter when it happens.
Exactly. And we need to get better at communicating with people, make sure everyone understands the risks, how to protect themselves.
Yeah, it's got to be more than just wash your hands, right?
Right.
Yeah.
People need to know the details, why it's important to take precautions.
And I bet there are a lot of myths out there about
Yeah.
norovirus, stuff that just isn't true.
Oh, for sure. Like people thinking hand sanitizer will kill it. We need to clear that up, make sure people have the facts.
So better tracking, clearer communication, ongoing education, and of course, research plays a big role in all of this.
Huge role. We need to keep investing in research to understand the virus better, to develop better treatments, and, hopefully a vaccine.
A vaccine would be amazing,
No,
especially for those who are most vulnerable.
absolutely. It would make a huge difference.
It seems like we're learning so much about norovirus right now. The summer surge has really changed how we think about it.
It has. It's a challenge, but it's also an opportunity, a chance to learn, to adapt, to get better at protecting ourselves.
So as we wrap up this deep dive, what's the one thing you want our listeners to remember?
I think it's this. Norovirus is tricky. It's constantly changing, so we need to stay informed, pay attention to what's happening, and be proactive. Wash our hands, disinfect surfaces, stay home when we're sick. All those things matter.
Great advice. Those simple actions, they really can make a difference.
They do.
Well, that's it for our deep dive into this unexpected summer surge of norovirus. We've covered a lot, but the conversation doesn't end here. Stay curious, stay informed, and stay healthy, everyone.